Welcome back. The Republicans raised and continue to raise Tea Party pitchforks against government health care. They've screamed that government health care would lead to the plugs being pulled on America's collective grandmas. So a couple of House Democrats got together and made a very simple request. Any Republican lawmaker that ran against government health care should opt out of government health care. That's about the most logical thing I've ever heard. Any Republican lawmaker who ran against taxpayer-funded health coverage should not accept taxpayer-funded coverage. How can you argue with that? Shockingly, though, the Republicans have not jumped at the chance to turn down their own government-sponsored, taxpayer-funded health care. At present, only 2 Republican congressmen and 3 representative-elects have pledged to practice what they preach. That's 2% of the 242 incoming Republicans in the House. So I guess they're 2% principled. It's actually a little bigger than I thought. Joining me now is Congressman Joe Crowley of New York, who issued the challenge to the Republicans in the first place. Congressman, welcome.
Thank you, Cenk. Good to be with you this evening.
Good to have you. Very clever, by the way. I got to give you credit for that. So I'm actually surprised that 5 of them took you up on it. Did you expect any of them to take you up?
Well, the number that did take us up on it, they have a plan B. Unlike most Americans who don't have a plan B, a lot of Americans don't have a plan A, don't have any health insurance at all. Some of these folks either work for a state government and have a pension from that and therefore have a health plan they can access. One of them is a former colonel in the Air Force who is not taking the congressional health care, but is going to take the veterans, the VA health care. So he's covered. Many of these people are individually wealthy. They don't need to have any coverage from anywhere because they can simply afford it out of pocket. So the hypocrisy continues. And I think even these folks who turn down the health care coverage from Congress, I think they're digging a deeper hole for themselves because it really adds questions, where are they going to get the health care coverage from?
Right. That guy who's taking the money from another part of the government, health insurance, he doesn't count. I'm knocking it down to 4. Okay, so
we'll take it down to 4. And I don't begrudge anyone who serves this country, and I think the colonel.
Yeah, he earned it. Don't get me wrong. Yeah, he earned it. Don't get me wrong.
But it is a plan B. It is a plan B.
Right, and it's hypocritical. Okay, now Michelle Bachmann, though, she wouldn't be hypocritical like this. I mean, she claims she's the leader of the Tea Party. Tea Party hates government-run health care. Don't tell me Michelle Bachmann has government-run health care.
Well, Michelle has a chance now. The year hasn't started yet. She can still turn down the health care that we modeled the health care for Americans on in this health care bill that we passed, that the president signed into law. And that's really what we're talking about, Cenk, here, is giving access to hardworking Americans, people who have found it almost impossible to afford insurance to date, the opportunity to purchase or to purchase insurance for them and their families. I don't begrudge even Republican members of Congress. They have families too, and they have spouses. They're under pressure to make sure they have coverage. I understand that. But the hypocrisy really rings through. And I think that if they want to stand by their word, they ran against this bill. They say they're going to repeal every bit of it. They should, in turn, turn down their own federally sponsored health care.
Congressman, real quick, though, I mean, they're saying, look, the government in this case is my employer, right? I just don't want the public to have that kind of health care because it's going to cost too much money. Do you think that's a fair argument? Not
at all. I mean, the reality is it's the public's money either way, and it's the same plan that we really modeled the federal retirement system plan and the health care plan on what members of Congress get. So I think it's a perfect opportunity for them to show that they stand by their word, that if they don't want it for the average American, they're not going to take it themselves.
All right, Congressman Crowley, thank you so much for joining us.
Thanks, Cenk. Thank you.
Appreciate it.